Hey everybody, Luke again. And let's say you had your total knee replacement and it's been 6 months to a year and your knee is still swollen. So in this video, we're going to talk about why is your knee still swollen, is it normal, and what can you do about it. So first of all, if you saw the video before this one, we just talked in generalities about with a total knee replacement, how long your knee is going to swell. So we said, 6 months to a year is pretty normal and the swelling should improve overall and it should be predictable. So on days when you're doing more activity, more demanding stuff, you're going to notice it swell more. And on other days when you're resting, you should notice it swell less. And in general, you should be getting better as you go along. So now let's say though that you're fast forwarding and you've had a total knee and it was 6 months ago or a year ago and the swelling is still there. Not only that, but the swelling is also causing some pain and some stiffness and you feel like you should be over the hump and you're just not. So this is a real problem for a lot of people with total knee replacements. Statistically speaking, about 10% of people are going to have some issue with a total knee, whether it's persistent pain, stiffness, swelling like I just mentioned. We're not always quite sure what's causing that. But if you are having persistent swelling and you just want to know what's going on, that's what I'm going to address in this video. So basically, what are some factors that are going to cause persistent swelling in a total knee? One of the factors, which is really common, is excessive scar tissue. So if you're one of those folks that scars up really quickly or really heavily, you probably would have noticed this during the rehab process. That can be a part of it. Now, scar tissue in and of itself, of course, is going to cause things like stiffness and pain. But in addition, what you want to start to kind of key into is the fact that swelling has to do with your body's ability to move fluid through your venous system, so through your veins, and through your lymphatic system. Now, most PTs, myself included up until recently, aren't really that knowledgeable about these two systems. We know swelling, but we don't always know quite what to do with it. So again, the scar tissue in itself can be a problem, but scar tissue is also going to be a problem because it's going to have a detrimental effect on your venous system and your lymphatic system, especially your lymphatic system. So if you're dealing with persistent swelling, that's something you want to consider right off the bat, is excessive scar tissue and the effect it may have on your veins and your lymphatic system. Now, I've got other videos that cover your venous system and your lymphatic system in detail, but in this video, I want to keep you more focused on the knee itself and what you can do about it. So look at that scar tissue. The other thing you want to consider is, did you have swelling in your knee or your leg before surgery? So for a lot of people, they've had previous knee surgery. Obviously, if you got to the point where you had a total knee replacement, you've got something going on with your knee to require the surgery. So if you already had swelling before the knee surgery, and then you have the surgery, which you now know is very invasive, lots of bleeding in the tissue, lots of swelling, what you can kind of conclude is that your system was already overloaded before surgery. Now, when I say your system was already overloaded, again, I'm talking about your veins and your lymphatic system. Between those two systems, that's what's reabsorbing the fluid that you're putting out, through your heart and your arteries and bringing it back into your blood supply. So if you already had swelling before surgery, now you know why, when you added a bunch more swelling to that same overloaded system, why you're having a problem after surgery. So that's something to consider. Now, where are we going with all this? You say, okay, is it the scar tissue? Is it the veins and the lymph system that are overloaded? I didn't mention it yet, but you might have other abdominal issues that are going to impact the flow of the fluid in the veins and the lymph system. So where are we going with all this then? So where we're going is that if you have a problem with those systems, the veins and the lymphatic system, you need to get someone who can help you clear those two systems in order to clear all the fluid, the swelling, the edema out of your knee and out of your leg. So for a lot of clients who have a total knee replacement and they have persistent swelling, we're not just saying, well, it's just facts of life with a total knee anymore. We're saying there are things that you can do to improve the flow of your venous system and your lymphatic system. So with that in mind, what I would say is if you want to know more about that, if this is something that you want to get into, I've got more videos that I'll link at the end of this video to the series that I have on the lymphatic system. And depending on where you live, it would probably be good to seek out a physical therapist who specializes in lymphedema and chronic swelling. And more than likely, even if you have persistent swelling in your total knee for 6 months to a year to 2 years, they can help you make some headway with help you feel better, reduce the pain, restore some mobility, and decrease some stiffness. So again, I'll link that at the end of this video. I'm going to make another similar video just about the #1 secret to ease up that knee range of motion. It'll be a very similar video to this one, but I'll link that up here as well. So that's it for today. Again, if you've got that persistent swelling and your PT did their best job as far as they could, you might be ready to look for a PT with lymphedema training who can help you clear out that whole system. And if you want to know more, of course, leave any comments or questions below the video. And thank you for watching, and feel free to subscribe if you like what you see. Thank you and have a good day.